My name is Kareem Shaath. I work at Orlando Health Jewett Orthopedic Institute in Orlando, Florida. We have the largest, busiest level 1 trauma center in the state of Florida. My practice relies around purely orthopedic trauma. I deal with high energy injuries to the upper extremity, lower extremity, and pelvis. The reusable depth gauges can be contaminated. We don't reuse drill bits, we don't reuse wires. So a depth gauge to be reused also doesn't make a whole lot of sense. So the addition of the Edge depth gauge into my operating room has benefited us in multiple ways. First off, it's sterile. It's sterilely packed, and so you don't need to be worried about any contamination. Also, it's very easy to use. It's very ergonomic. The hook on the tip of the depth gauge has been better than any of the reusable depth gauges that we have. It's also contourable, and it's a one-time use, so you don't feel bad bending the tip of the depth gauge and, potentially damaging it for one of your future cases or one of your future partners. Additionally, the screen on the depth gauge is very easy to read, and it is very accurate, and so it leads to a lot less in and outs, saving time and saving money for disposed implants that aren't utilized. There have been often times where we open the back table, you open the set, the scrub tech removes the depth gauge, and they find bioburden in the depth gauge, and that just leads to the whole back table having to be taken down, a new sterile setup being opened. It ends up wasting 20 to 30 minutes of valuable operating room time. Having a sterile depth gauge that is sterile every single time has eliminated that aspect of patient care. Edge is very beneficial in all of my cases because it leads to accurate screw lengths. Also, it helps the residents because at this point in their career, they have very little understanding of what the screw sizes should be. And so seeing the active feedback on the depth gauge as it goes in is very helpful to them as well.